If you've been dealing with low back pain for months or years and it's not gotten better, it's likely due to your plan. I'm gonna be breaking down exactly why many people never fully recover with their low back pain and what the 3 phases of getting better actually look like. My name is Dr. Alec Tremblay. I'm a rehab-based chiropractor and I help active individuals crush low back pain, knee pain, and shoulder pain. That being said, I have a 4-week low back course. It's a great entry point into getting yourself better. If you haven't tried anything, there's a link down below. It's $99 to get you more mobile and start making some progress on actually moving forward with your low back pain. If you haven't tried anything at all, it's a great spot to start. So like I said, there's 3 phases to getting better when it comes to looking at low back pain, or really anything in general, but especially in this case, low back pain. And that is phase 1 being calm things down, right? And most people are pretty good at this. Most clinicians are pretty good at this. We're looking at more passive therapies, right? Adjustments, massage, dry needling, cupping, all these things that are mostly done to you, and rather than you doing things yourself. When it comes to PT exercises, this looks like very low level foot in the door exercises. I'm talking bird dogs, dead bugs, simple bracing exercises. And generally people can get out of pain, in 4 to 6 weeks doing this stuff. But when it doesn't progress to the other phases, the cycle just kind of continues. We start increasing our intensity. We start going back to doing activities that were painful before. And now we've flared it back up and we go right back to the beginning of phase 1, right? More adjustments, more dry needling, more massage. And then we start thinking that, oh, we just need to maintain a certain amount of massages and adjustments and dry needling and do more bird dogs. And that's what's going to get us better. But the reality is we're staying in this one phase and we're never progressing past that. And that is causing us to re-injure ourselves over time. Now, phase 1 is not the enemy. It's a great place to start. The problem is, like I said, most people live here and are in phase 1 purgatory. If we go to phase 2 and we go to phase 3, you're gonna see a lot better results long-term. So what is phase 2? Phase 2 is what we call the build-up phase. Phase 2 is where we start exploring movements that were once painful that we haven't been able to do. So now we're starting to test, what can your body handle? What can we start reintroducing, right? If a painful movement was a deadlift before, can we start including variations of movements that start getting us exposed to that movement pattern again? Or if you can't bend over, let's start reintroducing some movement patterns that get us to start flexing the spine again. Now, during phase 2, if you are somebody who is dealing with low back pain in the bottom of a squat, we may not be throwing a barbell on your back really heavy right away, but we are going to be exploring things in that movement pattern that starts getting us moving towards that goal. If we can start getting into these movement patterns again, we start desensitizing the body, we start reducing fear around certain movements, and we improve our strength and conditioning overall. And phase 2 is an area where it could be as short as 4 weeks, it could be as long as 8 to 10 weeks. It's one of those things where it's individual to the person, depends on how chronic your issue is. Just getting to phase 2 is already putting you way ahead of people who just stay in that phase 1 purgatory. Then there's phase 3. This is where the real transformation happens, right? We've gone through phase 1. We've calmed things down, all right? You can bend over without your back seizing up or spasming. Then we've gotten to phase 2. We've started exploring bigger movement patterns. We started loading up the body a little bit more. We started doing exercises that were painful at once. Phase 3 is our strengthening phase and our exploratory phase. This is where we're gonna push to a lot higher degree. We're gonna start exploring new movement patterns. We're gonna start pushing ourselves into an area that we may not have been in before the injury. This is where we're really trying to push our mobility, our strength, our stability, and becoming a better version of ourselves before the pain and injury flared up to begin with. Most people were not in the most optimal condition, didn't have the best mobility, and then something pops up and we're just trying to get back to baseline. But in reality, if we want to prevent this in the future, we need to do better. And by the time we're in phase 3, the goal isn't just pain-free. We want to build enough capacity to where your body does not have to worry about doing new activities or pushing itself to a high degree of intensity. And when you're first starting out and you're in phase 1 and you're just trying to calm things down, phase 3 might just seem unnecessary and unrealistic and like you might never get there. But I promise you, if you take this step by step and you follow a good approach that addresses all of these areas individually, phase 3 is gonna be the most important phase of them all. I always tell my patients in my office when we get to phase 3, this is to really reduce the chance that they ever have to come see me again. If you're somebody who's been stuck in this cycle, you feel better, then you feel worse, you piss it back off, and then it repeats over and over and over again. I want you to know that there is a way out of this. And if you feel like you've been stuck in that phase 1 for too long, that's exactly what I help people with in my practice and online. I want you to hit that link down below and reach out to me if you have any questions or just drop a comment. I'm happy to answer any questions. And if you thought this was helpful, please subscribe, drop a like on this video, and I will see you in the next one.